A dangerous reaction to a COVID-19 infection has dropped to its lowest level since the beginning of the pandemic. I love saying that. Here to answer your questions, Dr. Kristen Moffatt, an infectious disease specialist at Boston Children's Hospital. Good to see you, doctor.
Hey, Dr. Moffatt, great to see you. The CDC has been tracking these cases of multi-system inflammatory syndrome in children since May of 2020. And so far, it's identified more than 9,000 cases and 74 deaths here in the United States. So do you believe that MIS-C is still a threat to kids?
Well, we certainly did see the majority of cases of MIS-C in 2020 and 2021. And we've really seen a substantial tapering off of cases since Omicron really emerged as the dominant variant. So that's definitely a good thing. But I think the issue here is that we really still don't understand fully what causes MIS-C, whether it has to do with something specific to the virus and a variant, or whether it has to do more with the child's immune response, or maybe some combination of both. So I think without knowing those details, it would be really hard to say that it's no longer a threat or that it might not become a threat again in the future.
Doctor, you actually treated some of these patients. What can you tell us about their symptoms and really, more importantly, about their recovery?
Yeah, they most often present with symptoms sometime, typically about a few weeks after a COVID infection. And the symptoms tend to include fever and abdominal pain, may also include vomiting and diarrhea or changes to the skin. Children can get very sick from MIS-C and require intensive care level treatment. As you mentioned, there have been some very severe outcomes, even fatalities from MIS-C, but fortunately, most children do make a full recovery from MIS-C, but longer term studies to see if there are any longer term impacts of having had MIS-C are still ongoing.
Dr. Moffatt, I'm curious, we've heard a lot about the effects of long COVID in adults. What about kids? What about diagnosing it in kids too?
Yeah, it certainly does happen in kids. We are absolutely seeing long COVID in children. Fortunately, it does seem to be occurring less frequently in children after a COVID infection than in adults after COVID infection. But as you could imagine, even if it's just a very small percent of children who get long COVID, so many children have had COVID infection now that could still add up to tens or hundreds of thousands of children who are impacted. We do have a multidisciplinary clinic at Boston Children's that takes care of children who are experiencing long COVID symptoms, and they're also hopefully contributing to a better understanding of how this impacts children.
Dr. Moffatt, thank you so much for joining us. As always, we appreciate it.
Great
Stay
to see
well.
you, Dr. Moffatt. Take care.
Good to see you too.